Hi, my name is Shirley Jacob, and today is the 22nd of February, 2021. I will be presenting on Cor Pulmonale, pulmonary hypertension. Here is a clinical patient presentation. A 50-year-old woman with known chronic obstructive pulmonary disease, or COPD, presents with labored breathing, chest pain after exercise, and swelling of her lower legs. She mentions she smokes regularly and often finds herself wheezing and coughing. Upon further examination, her external jugular vein is bulging, and she is noted to have an enlarged abdomen due to the accumulation of ascites. Etiology. First, you must know pulmonary hypertension. It is an increased vascular pressure in the lungs. This can be due to a chronic obstructive pulmonary disease. Eventually, pulmonary hypertension will lead to cor pulmonale and in turn cause complications to the right side of the heart, such as right heart failure. Listed below are some of the underlying pulmonary diseases that can lead to cor pulmonale. One of the most common is chronic obstructive pulmonary disease. COPD increases pulmonary vascular resistance, which causes the right ventricle of the heart to become enlarged. Interstitial lung disease refers to a large group of disorders where most will lead to the scarring of lung tissue. Such scarring can make it harder for the right ventricle to pump blood through the pulmonary valve into the pulmonary artery and eventually to the lungs. There is also thromboembolic disease. Blood clots occurring in the lungs can lead to increased resistance, which then lead to pulmonary hypertension. Background. In Latin, cor refers to the heart and pulmonale refers to the lungs. Cor pulmonale is a condition where there is hypertrophy and or dilation of the right ventricle. In 1931, American cardiologist Paul Dudley White coined the term cor pulmonale. About 6 to 7% of all types of adult heart disease in the U.S. are due to cor pulmonale. 1 to 3 people out of 10,000 a year will develop this specific disease. The prevalence ranges from 2 to 6 people out of 1,000 a year. It is a disease closely related with COPD. Most risk factors for cor pulmonale are conditions that lead to pulmonary hypertension. Smoking increases an individual's chances as well as COPD. Individuals with occupational exposures to harmful chemicals or substances up the risks. Obesity is independently associated with pulmonary hypertension. Patients with blood clotting disorders have a higher risk as well, as recurrent pulmonary emboli cause resistance. Living at a higher altitude is a risk factor, as living in lower oxygen levels can lead to hypoxia. There will be increased demand from the heart's right ventricle and add pressure on the pulmonary artery. The pathophysiology for cor pulmonale starts off due to pulmonary disease that affects the heart's right ventricle. This can either lead to hypoxia, where there is an inadequate amount of oxygen supply, or respiratory acidosis. Both instances, however, lead to a pulmonary hypertension, and if continued resistance occurs, hypertrophy and or dilation of the right ventricle will happen. Here are 2 images that show the instances of cor pulmonale. On the left image, there is a problem occurring in the lungs which lead to dysfunction of the heart, which is essentially the meaning of cor pulmonale. The image on the bottom right shows a normal heart, and next to it, a heart with the hypertrophy of the right ventricle. Signs and symptoms. Dyspnea is one of the most common symptoms of cor pulmonale. With our case study, we can see the woman as having difficult and labored breathing. Fatigue will also set in during exertion. Jugular venous distension occurs as there is regurgitation of the tricuspid valve. In our case study, we can see the woman's jugular vein is bulging. Peripheral edema is also a sign that occurs and is nonspecific. For the woman, she's having swelling of her lower legs. Hepatomegaly is common as blood will get backed up in the liver due to the dysfunction of the heart. This is referred to as congestive hepatomegaly. Ascites is another sign. There will be fluid accumulation in the peritoneal cavity, causing the swelling of the abdomen. And because of the hypertrophy of the right ventricle, a sign that can be seen is an RV heave. If you were to listen, you would be able to hear the right-sided S3 or S4. There are many diagnostic tests to determine for cor pulmonale. A physical examination can check for a parasternal lift, listen for an audible S3 or S4, look for a distended jugular vein, or check the patient's breathing pattern. With the physical examination, we are able to see the signs of cor pulmonale that were listed in the previous slides with signs and symptoms. An ECG or electrocardiogram would be the initial diagnostic test choice. It records the electrical signals from the heart. In doing so, it can check for the right ventricle hypertrophy. If a patient did have cor pulmonale, the S1Q3T3 would be inverted. There is the presence of an S wave in lead 1, a Q wave in lead 3, and a T wave in lead 3. If an electrocardiogram is not used, an MRI, magnetic resonance imaging, is a good substitute. It can assess the pressure, size, function, myocardial mass, and viability of the heart by taking detailed scans and images. It can check for emphysema or any ILD that contribute to cor pulmonale. A chest x-ray can be used to check the right side of the heart for cardiomegaly, an enlarged heart. Another diagnostic test of the many tests is a right heart catheterization. This is a critical test for diagnosing pulmonary hypertension. This is a closer look at a right heart catheterization. It is used to see how well your heart is pumping and can measure your blood pressure in the heart and in the main blood vessels in your lungs. A special catheter is used to enter the pulmonary artery. A sensor on the catheter is constantly measuring the blood flow while it is moving through the right atrium, right ventricle, and pulmonary arteries. Now here are some medications to treat cor pulmonale. Treatment of cor pulmonale means treatment of the underlying cause. Continuous adequate oxygenation helps to relieve the right ventricle and decreases the pulmonary vascular resistance. Giving diuretics to patients can help to manage the right ventricle overload in chronic cor pulmonale. Warfarin can also help. As an anticoagulant, it will help to prevent blood clots that occur, especially in thromboembolic disease. As for surgical management, a heart transplant is only necessary in the most severe cases of cor pulmonale.